We seem to have a lot of attendees joining. The webinar will start in a few moments, or I should say the conversation, because this is not a traditional webinar. So give us about a minute and we will kick things off.
Okay, thanks everyone for joining us, and thanks Jackie for doing all the setup. Our focus today is the Equal Access Rule and why it matters. Our panelists will be sharing their perspective about the importance of the Equal Access Rule and encouraging you to submit comments. And to make comments, use the portal housingsaveslives.org. I welcome people attending this session to share their own perspective about why the Equal Access Rule matters to them in the chat box and or via Twitter. We would like to lift up some of those comments to educate others about this, how important this is. So please let us know if you don't want your thoughts shared. We will keep all names and programs confidential. Our hope is to urge listeners and the people you know to act and make comments, but sharing the perspective and experience of others is particularly important. We particularly hope those with lived experiences will feel safe here in sharing what it means to them when services are not safe or welcoming, and why the Equal Access Rule needs to stay in place. So we particularly welcome thoughts of people with lived experience. Our guests today include Oliva with the Center for Budget and Policy Priorities, Jackie Janosko, I hope I pronounced that, Jackie, right, with the National Alliance to End Homelessness, Veronica Lewis with Services for Special Groups and HOPICS in Los Angeles, California, and Jeree Saucedo with Salvation Army of Southern Nevada, and Debbie Fox with the National Network of Domestic Violence. It's an impressive group. Thank you all for taking your time to share your experiences. I'd like to start with Anne. Anne, can you tell us what is actually in the Equal Access Rule, what it requires of homeless service providers, and what the current administration is proposing to do with it?
Yep, sure, of course. So for folks who maybe don't know me very well, I'm a visiting senior fellow at the Center on Budget and Policy Priorities right now, but I was for 10 years a career public official that sort of oversaw the portfolio of special needs programs at the Department of Housing and Urban Development, including the homeless programs and the HOPWA program. And I start out by saying that because I was one of the career staff that were involved in the development of both the 2012 Equal Access Rule, which was the original Equal Access Rule, and the amendments that were done in 2016 that are now being proposed to basically be erased. And I will tell you, just from in my own career, this is one of the things that I am most proud of having done at HUD, and am fairly horrified at the current proposed rule. So that's going to come across a little bit in my comments. And I guess the other thing I would just note before I dive into the details a little bit is that I myself am writing some comments about this proposed rule change. So it's on my mind a lot. I'm dreaming about it. So happy to take questions as well. So I think it's important for folks to really know that this rule is a little bit different than other rules at HUD, because we did it not in response to a specific statutory requirement. So, you know, in a lot of cases, a law gets passed by Congress, then we write regulations in order to implement that law. And this is a little bit different because we actually undertook this work because we saw the types of discrimination that LGBTQ people were experiencing and facing across all of HUD's housing programs. And we as a team wanted to do something about it. Marion McFadden, who is now at Enterprise, was the primary drafter of the 2012 rule. So that makes it a little bit different, and our intent and the reason that we did it was because we wanted to make sure that all of our programs were operating consistent with HUD's goal to provide decent housing and suitable living environments for all people. So that was the basis of our work. And in 2012, we looked at a variety of different sources of data. We looked at Fair Housing Center data, National Gay and Lesbian Task Force data, National Center for Transgender Equality data, and what we saw was that LGBTQ folks obviously being discriminated against across the board. So we decided to issue our first equal access rule, and that was effective March 5th, 2012. So you hear a lot of us referring to the 2012 rule and the 2016 rule. And what the 2012 rule did was it applied to all of HUD's HUD assisted or HUD insured housing. So it's a pretty wide range. And in the most sort of fundamental sense, it basically prohibited discrimination against people for actual or perceived sexual orientation, gender identity, or marital status in all of HUD's programs, which was a great step. But at the time, we actually knew that we hadn't gone far enough on the issue of access to single-sex or sex-segregated facilities. And the rule itself actually notes that we didn't think we went far enough and that we were going to conduct additional work in order to get to the right answer and the right policy on single-sex facilities. So in 2016, we released the second equal access rule, or the amendment to the original equal access rule. It became effective October 21st, 2016. And in effect, what we did was we required all programs that were allowed to have facilities that are sex segregated, and that can only be done in very specific circumstances when there are shared sleeping or bathing accommodations. And the majority of those programs were programs under my purview. The HOPA program, the ESG program, and the Continuum of Care program are the bulk of the money for programs that have shelters or transitional housing that are single sex. And what we basically did was tell all of those programs that they were required to accommodate people according to their gender identity. It is quite simple. We serve people in the manner in which they ask to be served, and do not ask them questions about it or question their how they are presenting. That it was fairly simple. We also issued guidance and training materials, which after the Trump administration came into the building, they required us to pull down. And from a personal standpoint, for me, that was the moment that I realized I really had to go. So to answer your last question, Sharon, what these proposed changes do is it changes the standard of who gets to make the policies from sort of the federal level and the system level, and gives it to individual programs so that it allows individual programs to turn away transgender people based on something that they call a good faith belief that somebody is not the, and I'm going to put all these things in air quotes, biological sex that a program wants to serve, and that program can request evidence if a staff person does not believe what they are being told. And so that also makes sure that it's not that it actually puts the power all the way down to the staff level, because it is very hard to implement something that's called a good faith belief, because there's no actual definition of that in the rule itself. The rule does require that programs who turn people away because of their gender identity have to refer them to another program. But what it doesn't require is that there is any program in a particular area of that continuum of care or that geographic area that accommodates people according to their gender identity. So it's completely plausible that all programs in a particular area could decide to turn away people based on their gender identity, and that there would be no options for transgender or non-binary people within a particular area. So I'll stop there and see if there's questions or more detail.
I actually have two follow-up questions for you. Both were embedded in your answer, but I want to pull it out. So you said that you looked at a lot of data and you had a lot of information, and that compelled you under your leadership, SNAP's office, to really go a little bit further in the equal access rule and the amendments. Can you tell us what was most compelling for you in wanting this to be implemented, and in making this the proudest thing you've done while you were in charge, or one of them?
So it was around that time that we also started really doing some deep work with youth and young adults experiencing homelessness. And as we know, youth and young adults experiencing homelessness, there are a lot of risks for LGBTQ young people. They're twice as likely as their peers to experience homelessness. And I had the opportunity one day, the data and the sort of listening sessions and all of the things that we did were incredibly important. But I will tell you, sitting across the table from a young woman who told me that she was spit on when she presented herself to a shelter in accordance with her gender identity, I will never forget that. She was traumatized, and in a system that's supposed to be helping her. And it felt incumbent upon me and my team and Jennifer Ho and all the leaders that were working on this to address that issue and to address it quickly.
Thank you. And then the last is, again, also embedded, but what do you think the big danger is if the equal access rule were to be withdrawn or suspended?
Yeah. So this change, I want to be super clear what this change is. This change is government sanctioned discrimination against transgender people, period. That's what it is. It puts the desires and needs of particular programs over the needs of people who are experiencing homelessness and housing instability. And we've heard from people. One of the things that they didn't do that we did quite a bit of, and that, as you can tell, impacted me and my team, was that they didn't ask any trans people about this change. There's no documentation in the preamble to this change that shows that they bothered to ask people how it would impact them. But we know, because of the work that we do, everybody who's on this panel knows that people will decide to be unsheltered before they go to a place that's dangerous, that feels unsafe, that is discriminatory, and that trans people and young people face a lot of violence on the streets when that happens. And we also know that when you're talking about government sanctioned discrimination, they might say it's right here at the front door, but once you allow it at the front door, it carries all the way through the system. So when you allow it in one place, it's going to keep going. And I think what we were trying to do with the amendments to the original equal access rule was to stop that, was to show that our value was that all the way through the system, people should be treated with respect and should be treated in accordance with the way they want to be treated and their own gender identity. So, the other harm that I think is important to note is that it is actually, the way that it's written, it's unworkable, it's unimplementable. Because it relies on this thing that's called good faith belief, which is undefined and is really at the whim of whoever happens to be sitting at the front desk that day. and it allows determinations to be made on like physical characteristics that are discriminatory. And people can be subject to inappropriate questioning about their physicality and about how they dress. And so I think all of those things, it's runs the gamut. The harm runs the gamut from, you know, potential violence and an increase in violence to really just traumatized through a system that's supposed to be helping folks.
Right. And it compounds trauma, I think. These are not these are folks who have been harmed throughout multiple systems, and this is supposed to be a system of support and care. Thank you, Anne. Jackie, you have been taking a look at the research point in time and some of ORG-CO's research that they made available to us. Could you tell us a little bit about what you've learned about transgender individuals experiencing homelessness?
Sure. So thank you for having me on this webinar or conversation. I keep calling it a webinar because that's the platform. But I've done a lot of research review on the issue of trans and non-binary homelessness. So first of all, the number of studies on transgender homelessness it pales in comparison to the number that's been done on things like the chronic subpopulation, the veteran subpopulation, youth, etc. But the thing that I can say 100% assured, all of the studies that I've read on transgender homelessness all say the same thing. Transgender people experiencing homelessness face extraordinary challenges, including discrimination, and they have greater risks to their health and safety than their cisgender peers. So usually the data that we look at is point in time count data, which doesn't really tell us a whole lot. It just tells us who was found on a particular night and where they were located. We can't do any kind of intersectional analysis on that. So all we can say is there were X number of people at a given point in time. But what that does tell us is also we can look at some trends with the data. So what we found when looking at AHAR1 point in time count data was that the number of adult transgender individuals experiencing homelessness increased 88% since 2016, and the number who were unsheltered increased 113% in that same time period, which means that more people who are transgender are identifying as homeless, and they are more likely to be unsheltered than their cisgender peers. The numbers on that, 63% of trans individuals who are homeless are unsheltered compared to 49% of cisgender people. So that just tells us some very basic information. There's not a lot we can do with that data because we don't know if we've captured everybody. We don't know, you know, there's just a lot of unknown variables. But what we did do was we analyzed some anonymized VI SPDAT data from ORG-CO, as Sharon mentioned, and it was an absolute like gold mine of data on transgender homelessness that we haven't really seen at this level before. So we found the difference between sheltered and unsheltered homelessness among transgender people to be just like astounding numbers. For example, the number of people who identified as trimorbid, which is someone having a co-occurring physical, mental health, and substance abuse disorder. For sheltered transgender individuals, it was 3%. For unsheltered, it's 60%. 60. I mean, that's a huge discrepancy in the numbers. The number of people who say they engage in risky behavior is 18% for sheltered. It's 98% for people who are unsheltered. So, you know, and then something along the lines of being forced to do things they don't want to do. It's 11% for shelter, but 40% for unsheltered. And then, you know, when you look at things like system interactions, people who are sheltered have much fewer interactions with the healthcare system and the criminal justice system. So for example, the number of police contacts per person in the last 6 months for sheltered people is about 2.7, but for unsheltered people, it's 21.3. So that's telling us that people who are unsheltered are engaging with the police at a much greater rate. And that's, there's a myriad of issues that go along with that, the least of which is, the trauma it's causing someone who's experiencing homelessness. But also, it costs taxpayers money to have that much police involvement for people who should just be housed. When we did a further analysis of the data by race, we found some interesting trends as well. We found for unsheltered people experiencing, or unsheltered transgender people, we found that 100% of the people who are Black said that they are engaging in risky behavior. So, there's a whole bunch of things that fall under the risky behavior category. It's up to the person who, reports this information to determine what's risky for them. But the fact that 100% of Black trans people who have responded to this said that they are engaging in risky behavior is very, very concerning. And unsurprisingly, there's disparity between the rates of police interactions and jail and prison stays by race. And I will throw in a caveat that the data we had was mostly for Black and white transgender individuals. We didn't have enough data on other ethnicities or races to do a fuller analysis on the different subgroups. So that's why I only have a comparison between Black and white. But what I will also say is you can find a lot more of this information on our website. We did a brief about it, and all of the data that we analyzed is in that, so you can do a little bit more, reading on your own. And I won't bore you with tons and tons of statistics and data because that's not the point of why we're here. But we do have this information on our website. So, if you'd like to learn more about the disparities between both sheltered and unsheltered trans people and unsheltered people based on race, that information's all available online.
Thank you very much, Jackie. And as a follow-up question, I think what's striking about the data that she shared, which shows the vulnerability, particularly amongst those who are unsheltered, particularly among Black people who are unsheltered and transgender, is the disparity and the harm is still being inflicted, even though the equal access rule is intact. So, Jackie, what does that tell you around what people can do?
Well, equal access is a baseline. It's just saying this is what you have to do. It's not the end all be all. The end all be all is having shelters that are safe and accommodating and welcoming to people regardless of their gender identity. So, homeless service providers need to be better equipped with knowledge so that they can actually do the best job they can to help someone experiencing homelessness who happens to be transgender. The data that we have now currently reflects the system with equal access intact. So seeing what we see for sheltered people versus unsheltered people, that tells me that it would be catastrophic to go backwards. I mean, literally we could be condemning people to die on the street, because if 60% of the trans population who's unsheltered is trimorbid, they're suffering out there and they are at risk of dying. So, the thought that we can roll back these protections is just, it makes no sense. The homelessness system should be supporting people who are trans and homeless, just as they should be supporting anyone else who's homeless. So this is the messaging that HUD needs to hear, that we're all in this together. We're trying to serve people to the best of our ability with the best information we have. We don't want to go backwards and cause more and more harm to people who are already facing tons of discrimination and just, all kinds of trauma. So yeah, it's the message that HUD needs to hear, and it's why it's so critical to, send your comments to housingSavesLives.org. So yeah, it's there's a lot of health and safety issues, and I encourage you to read the brief that's on our website so you can learn more. Because it's clear that we can't take a step backwards.
Thank you very much, Jackie, and thanks for that plug. So again, we're really hoping that you your colleagues, people in your network make comments via that portal, housingsaveslives.org, and do it quickly because it's September 22nd. So now we're going to turn to people who are actually doing this in their communities and in their programs, making homeless services better for people who are transgender. Veronica, can I start with you and ask you to tell us a little bit about how HOPICS is working to create safe, welcoming space for transgender homeless adults across all of your programs in Los Angeles, and then a little bit more about the experience of creating a dedicated program for transgender women.
Sure. Thank you so much for having me. I'm grateful to be a part of this discussion. It's very important. And Oliva, thank you for your courage 8 years ago. And I appreciate that you're still in the fight to make sure this doesn't go away. So HOPICS, we serve Los Angeles, in particular, South LA, the city of Compton and surrounding communities. And we do literally everything on the gamut of homeless and housing services, all the way from street based multidisciplinary teams to permanent housing support and everything in between. On any given night, we are keeping about 2,200 individuals, including about 1,000 children, off the street in a variety of interim housing programs, crisis housing, trailers, safe parking, sprung tent structures. We have a variety of interim housing. And, you know, I actually was a part of the Los Angeles Continuum of Care Board when the Equal Access Rule came out. So I had the privilege of talking through what does this look like, how does Los Angeles craft a policy, start to include it in their contracts to guide their providers, and actually how do we move from concept to application. So I'm very familiar with it, and had a piece of helping to push it forward in LA. And for us, we have done a lot of transitioning, in particular in our interim housing sites, where LGBT people that are a part of the LGBTQ community really feel unwelcomed or experience, unfortunately, abuse. And so, you know, things like all gender restrooms, and even looking at the intake forms and the way we ask questions, and trying to create affirming spaces regardless of people's gender identity and sexual orientation is something we've done throughout all of our interim housing portfolio. However, again, as one of the panelists said earlier, the Equal Access Rule just set a standard for how we're supposed to operate, but there's still many things that have to be done, I think, system-wide, to make sure that people feel welcome in any door that they walk into. And so for years now, I've been having conversations with my colleagues who do a lot of work specifically with the LGBTQ population, HIV, people who experience HIV, and in particular, trans women of color. And they continue to tell me about their experiences of trying to access services, as I call it, in the mainstream homeless services system, and them sleeping outside, choosing to sleep outside because the experience was just so bad, traumatizing, triggering, and many of those folks ended up being attached to sex work and other things like that. And so for years, we were trying to figure out how can we create a safe space specifically for trans women in Los Angeles. And an opportunity came about 18 months ago, where they were rolling out a new model, essentially an enhanced service model of crisis housing or bridge housing, specifically for women. Now, of course, nobody thought about trans women, but I saw that as an opportunity to try to open up the first LA publicly funded site for trans women. And so we fought a lot of battles. It was an uphill battle, but we won. And about a year, actually exactly a year ago, we opened up a 16-unit crisis house or bridge housing site specifically for trans women or gender nonconforming folks. And we have learned a lot even in that experience, right, that informs how we're working in our other interim housing sites or programs in general that are serving people, to make sure that we're responsive.
Okay. So you, I have a couple follow-up questions. You hit yesterday in our pre-planning call for this webinar today, what it meant to some of the women that you're serving in this new dedicated shelter space to have this space. Could you share a little bit with the audience about what what you're hearing from the residents in this facility about the importance of having a safe and affirming place, and also why you believe that creating a safe, affirming place across the entire system matters.
The women that we're serving are grateful to have a safe space where they are welcome to be who they are without ridicule, without fear of physical abuse, verbal abuse. And quite frankly, it just restores a sense of human dignity where you don't have to choose to be in fear of for your life if you go inside versus living on the sidewalk and dealing with the things that come. And so just not having to make those kind of tough choices, which are nobody in our system that's experiencing homelessness should have to make those kind of decisions. And so to know that this was created for you, and a lot of the program design elements obviously came to be because of conversations with the very women that we're serving. And so they're grateful. They feel affirming. They feel that we're affirming who they are. They feel that they can actually stabilize and focus on other parts of their journey, because as we know, when people are trying to figure out where they're going to sleep at night or trying to figure out whether or not they'll be safe wherever they choose to sleep that night, it's hard to continue to move forward, right, to stabilize other parts of your life. And so really what it creates is an opportunity for people to center and start to move forward with whatever their objectives are to go to the next phase in life. And so it's been life-changing and life-altering for these women to have this type of space made available to them.
And you oversee a whole continuum of services to people experiencing homelessness. So people who are transgender should not, no one should encounter any one of those programs and experience hostility. So as we move forward and try and improve work in our homeless service system, you know, what do you think some of the next steps for the field is? Preserving the equal access rule, but extending it so that it's not just about harm reduction, but it's actually creating environments that help people thrive and support them in who they are.
Yeah, I think there's a lot of work still to be done to, again, the application of the concept, I think is where a lot of the providers and even just the system leadership, not just providers, but the system leadership of the different continuums of care are struggling. And so I think that really drilling down now that a lot of the communities do have experience with making some of those recommended adjustments, I think actually having specific recommendations about the different key facets of the homeless services system. So the intake process, the assessment process, considerations for placement, obviously considerations not just in terms of the physical aspects, including restrooms, which is a big one, as we know, but the program design of interim housing, the program design of even some of how these permanent housing units are being built. And there's even conversations with landlords that I'm working on right now, right, to demystify and to educate and to try to minimize discrimination in terms of market rate units. So I think we would benefit greatly from having specific recommendations focused on the actual activities that take place within the homeless services system. And internally, that's what I've done, but I think that would be useful because a lot of people just don't know how to interpret it and actually realize it and have it manifest in creating welcoming and affirming and safe spaces for folks that are part of this community.
Thank you very much. Jeree, can you tell us a little bit about the steps the Salvation Army has taken in accordance with the Equal Access Rule and your experience implementing it?
Absolutely. Hi, everyone. Thank you for having me and the Salvation Army on the call to represent. You know, we have taken the Equal Access Rule very seriously since its inception. Thank you, Anne, for all your dedication with that. And what that includes is across the board staff training, educating. The center here in Southern Nevada is a wonderful partner of ours that we've had them come and talk to us and kind of enhance our knowledge here, and just keeping up with the staff training and the open dialogue, as we have a pretty large staff here. And like any organization, turnover sometimes, we have to stay on top of making sure that everybody knows about the Equal Access Rule and how we work within that. And so I'm happy to say that all of our programming as it applies to our homeless services programs are available to anybody regardless of their gender identity. We take them as they identify and immediately try to determine how we are going to help them. The Salvation Army is of the mindset that we welcome everyone and anyone that is looking for help, and how can we help them? How can we serve them? What does that look like? If we're not able to assist them, if we don't have the services, we have amazing partners here in Southern Nevada that we reach out to, and it's regardless of how anyone identifies. We're just here to try to help. And even more so nowadays, the need is even more real. People are frustrated for so many very reasons, whether it be the pandemic or politics or just changes in housing and restrictions and availability. So it's needed more than ever, our empathy and our grace, and we're determined to keep that in the forefront of our minds. We have evolved, thankfully, in our program policies over the years, and I think there is absolutely room for continued growth. I am big on dialoguing. We have amazing people here at the Salvation Army that are very talented, very skilled, and bring a wealth of knowledge and experience. And I am all for kind of going in the war room and having ongoing discussions how we can evolve. Originally, our safety dorm, as we refer to it, did begin as a specific transgender dorm. The need in our local community was that a lot of male to female transgender individuals were in need of our help and needed a safe space. And if they came here and they specifically asked for that safe space, for whatever reason they felt unsafe, we have this space for them, 18 beds, private restrooms, and ability to talk to our staff about their needs. However, based on continuing dialogues with community members, specifically the center, we have now over the years evolved to open our safety dorm to anyone within the LGBTQI community, as that was stated to us that there was a need for all individuals, that some felt like our safety dorm was excluding them and they weren't welcome if they came here, if they were interested in that space. And so through those conversations, we determined that our safety dorm would be opened. We still have a very good standing with those within the transgender community, that they are welcome here. But I do think that when we kind of expanded the availability of that safety dorm, some may have felt like it wasn't exclusive just to them now. And I think that's where the dialogue, we need to continue the conversations to be open so that people are educated and people feel that we want everyone to feel safe, that is a priority for us, that nobody is on the street and feeling safe, but that our most vulnerable groups are especially addressed, that their needs that we're especially aware of more than all of our vulnerable population. So I do believe that the conversation within our organization needs to continue so we can continue to evolve. And again, I'm thankful for our strong relationship with the center because they provide so much knowledge for us and expertise. And what Jackie was saying earlier, some of the statistics, Jackie, that you were talking about, just kind of, I had to jot down because some of this stuff I'm not aware of present day, like in the moment right now, what our current stats look like. And so as you're saying them, I'm writing them down because I'm like, didn't know that, especially the trimorbid, like statistic for unsheltered that just astonished me, you know, like, whoa, that's where we are, you know, right now. And those are the things I kind of want to be able to discuss with our powers that be within. What do we do? How do we address it? And then our community partners. And the beauty, I think, about right now with the pandemic is that before we had to schedule all these in-person meetings, and now look at us, we're virtually online sharing our knowledge and our expertise and learning from each other. So I'm kind of excited about that being able to continue in a way. Of course, I love meeting in person, but I'm just excited that this kind of dialogue will enhance our knowledge. And I know I'll walk away from it being able to then talk to my staff about where we go from here, based on some of the statistics and information that's being shared. Our safety dorm is well known within the community, and that makes me very proud. And I know that Salvation Armies around the country operate just like we do here in Southern Nevada. We welcome all, and we are especially sensitive to our most vulnerable clients, and try to just serve with empathy and grace, and addressing their needs as they present their needs, whatever those may be.
I mean, I think it's interesting that both of you are leaders trying to make sure that all of the programs that you operate for homeless people are safe, affirming, welcoming places for transgender to be, and yet you're finding people want that extra level of safety and privacy, and I think that's something that we need to just remember. But obviously we want people to have choices. They should be able to access any single service in our continuum and be respected and providing affirming space. Jeree, could you maybe speak for just a minute or so on the importance of the equal access rule for you and what you perceive as the danger of it being withdrawn, both in your own locality and maybe across the Salvation Army networks?
Absolutely. I think just, I guess on the surface, I would say that, you know, we've all been trained here locally, whether we went to a training that was provided by our local Clark County on updates to the equal access rule last year, or that we've done the training in-house to keep, you know, the dialogue going. I think just on the surface, if people hear that the equal access rule has been changed or altered, I think some people will have a tendency of thinking, well, then that's just, we're not focusing on that anymore. That was deemed ineffective. I think the minute you start changing something, people might tune out and say, yep, we tried to enact that years ago, didn't work, didn't go well, so let's just push it aside as another failed law, legislature, statute, whatever they frame it in their head. And then there's a tendency to just kind of shuffle it away, like, let's not pay it any mind anymore. And so I don't want that to happen. I want myself, my colleagues, everybody here at the Salvation Army in Southern Nevada to know that the equal access rule is just as important today, if not more important than it's ever been. So if we start changing that, if we start chipping away at any part of it that makes it less than, I think that it has the potential for people to start discarding it just by human nature. So we need to enhance it, not reduce it in any way, and leave it for individuals who may not be as educated as we'd like them to be. And I say that delicately because I don't want to insult anybody, but like Anne was saying earlier, that when you leave it in the hands of individuals that may not be as educated, and they now have to make a good faith decision based on what they see on physical attributes, now you open for biases and prejudices and, you know, possibly an education to frame these decisions. And that's the last thing we need. We need more education. We need more safeguards. So I think what could potentially be changed could be disastrous for us when we're all already, as social workers in this field, have a tremendous desire to help people and try to save people. Oftentimes as social workers, if we can't save somebody, we can go home and be very stressed at night. Just if we feel like we can't keep one person safe. So the last thing we need is to, you know, regress back on what is available for some of our most vulnerable populations.
Thank you, Jeree. And what you said about it communicating a message that this is a policy that didn't work. The other part of that message I heard from you that I think particularly important to pull out is that it doesn't matter. It's not important that we're rejecting a whole segment of the population and not requiring that they get dignified services. And when you think about the societal messages and the internalized issues that that people who are transgender are experience because of that, it seems particularly harmful. So thank you. Veronica, you wanted to say something else there before I turn to Debbie. Yeah.
Just plainly, the danger of the equal access rule not being a national standard that's set and people are expected to adhere to is the reversion back to the reason we needed to create it, or Oliva and her colleagues needed to create it in the first place. People not being treated fairly, people being discriminated against, people being physically assaulted. And I think, quite frankly, this rule humanizes everybody that's in need of homeless and housing services, regardless of who they are, who they love. And I think, you know, unfortunately, especially in the last year and a half, we have seen in our country that there are a lot of groups of people that are disenfranchised simply based on how they look, what they wear, what perceptions are about, you know, what their identity is. And you know, we have to be able to make sure that everybody has access to services, and that these organizations, many of which have public dollars, I'll just say it that way, are held accountable to serving everybody that needs their care.
Thank you. Debbie, you're a national advocate on domestic violence issues, but you've also been a frontline provider of services. What are the domestic violence providers that you're working with? What are they saying about the importance of retaining the equal access rule and its doability? Is it a doable rule to implement in domestic violence programs?
Yeah, thanks, Sharon. It's good to be with you and everybody today. This is such an important conversation because we want to make sure that everyone has access to shelter, and in particular, transgender individuals have access to shelter, and especially during this time where even being outside is a harm in some parts of our country with climate change as well. So I think that the domestic and sexual violence field, we unequivocally support the equal access rule. And we have worked diligently. When the equal access rule came out, I was real appreciative of Anne's description. Like, it really did help our field kind of think about it differently and start making those moves. There is something when there's a federal initiative and federal guidance that makes programs think like, okay, I need to do this. And so there has been a lot of transformation in our work and in our field. But also with our funding, we have the Violence Against Women Act funding, the FIPSA, Family Violence Prevention Services Act funding. We have a whole host of funding streams that also are really clear that we need to be serving all survivors. And that includes gender nonconforming survivors, that includes transgender survivors, that includes men as well. So many of our shelters also serve men and women in housing shelter situations. So we really want to be inclusive in our services. And just today we had a letter writing party. We're doing a letter for the field, a sign-on letter for the field. And we have hundreds of organizations signing on. But the message we are getting loud and clear from our field is we support serving all survivors. it's critical because the messaging that we've talked about in this discussion is, you know, what happens a lot when you're gender nonconforming, transgender, queer, you get a message from society, from family, religion, system, school, that you're not, you know, you're othered, or you're not good enough. So you also get that sometimes in a partnership. So if someone is in a partnership that is transgender, gender nonconforming, LGBTQI, if they're also hearing from their partner and someone they love, that if they go to seek help, they're not going to get shelter because of this rule or this law, that even now you're discriminated against to get housing. Basically, so many doors are closed for you. So those are societal, familial, all the different systems that a person needs to interact with. So we as a field are very clear that we're serving transgender individuals, and that there's a very tiny fraction, a fringe group of feminists that talk about supporting rolling back equal access, but by and large, all of the advocates in our field that are actually doing the services on the front lines, running shelters, running programs, and have done them for years, are inclusive and welcoming and affirming. And we're signing on to that, and we're making sure that it's known to HUD as well that we support transgendered individuals. And then we did talk a lot about how it is government sanctioned discrimination, and how that is just wholly unacceptable. And we can't have the equal access rollback and have just people making discretionary choices based on gender or appearance. You know, I am someone who's misgendered. I have friends who are transgender. Like, these are things that people on the front lines in a shelter, it is not part of their job. It creates an undue burden to their job, and it creates so much confusion to the field. And I just think so much of this is based on fear. There's been a long history of creating fear against gay people, transgender people, as scapegoating for problems in our society. And we know that is not the case. And transgender and LGBTQI individuals are often the folks who are trying to heal and make the world a better place. And there's no data or information that's saying if a transgender individual goes into a shelter or a women's shelter, domestic violence shelter, that they will harm other people in the shelter. That's a myth that we hear about this. It's absolutely not true. And our shelters are very well structured and organized, that if there is conflict or violence or challenges in a shelter, we are able to address that. And then we also have laws on the books if there is violence among individuals. So there's many ways that we can remedy situations if there's safety issues in a shelter or in a program that do not require additional government sanctioned discrimination, as Anne mentioned. So yeah, we're in support, and we will still give guidance to our field to welcome any and everybody and all survivors into shelter during that time when they're in a lot of danger and they need the most support, and they need that time to heal from the abuse. And they also need to get messaging that they are worthy, and they are worthy of support and love and healing time within our shelter and our programs. I think you're muted, Sharon.
How did that happen? Thank you, Debbie. And something that you said to me the other day that I think might be worth reiterating is don't disband the equal access rule in our name. This is not helping survivors of domestic violence. The survivors of domestic violence are more likely to be victimized than perpetrators. What would you like the domestic violence providers, advocates, survivors in your network to be communicating via the via the portal that we're encouraging people to speak through, the housingsaveslives.org? What do you want folks to be conveying to HUD?
Yeah, so yeah, definitely loud and clear, not in our name. We are not wanting to roll back the equal access rule in any way. It does not create safety for women. It actually creates additional harm for women and all women by rolling it back. And we're very clear with our letter that in our template that we think that the equal access rule is saving lives and protects women and protects transgender women, and that they are at the highest risk, the most alarming rates, especially transgender women of color, Black women, are at increased risk of trafficking, sexual violence. So we unequivocally support the equal access rule, and we will continue messaging with our field that we are in support of it, and we'll continue to do trainings with our membership and our state domestic violence coalitions and our 2,000 member programs will continue to serve all survivors. And it includes men too. It's really important that we serve all survivors, whatever gender that they come in. So we don't want any additional confusion created in the field by rolling this back. And we've seen great strides in the field and great improvements in the field by becoming more inclusive. And I did mention to this the other day, Sharon, that like I have worked in shelters, been a part of transforming shelters to make them more inclusive for all genders. Lived on site at a program in the 90s that was, you know, families, couples, individuals, you know, transgender individuals, like people, we lived in community, and we addressed issues as they arose. So to scapegoat one population who is so marginalized, to scapegoat them as people who are violent when there's zero statistics around that is just inhumane and wrong, and it's based in so much fear around transgender individuals. And I think there's just a human level piece of we need to get to know one another, each other, even in COVID or socially distant times. Like there's a fear that I think people are not connected or don't have transgender individuals or LGBTQI individuals in their friends and family networks. And that speaks to a lot of the fear around this, that people would believe that this is something that is worthwhile to do. So I'm soapboxing a little bit. We have a minute, so I'll turn it back to you.
Okay, and we are kind of tight on time. People did not use the chat feature to share their own experiences, but I hope you do share your own experiences and your perspective with HUD. Again, housingsaveslives.org. We had one question, which if somebody feels capable of answering, I'm going to throw it out to the group. If not, I can answer offline with somebody with more legal expertise than I. And the question was, can anyone discuss the legality of having a transgender only shelter program? Or should I get my boss, the lawyer, to give me a good answer, and I'll email that person?
Yeah, that was one of the battles that we fought in our region, to say that we cannot not include cisgender women, but we share some of the same data that was shared earlier, and we just pushed and really demonstrated the amount of violence that trans women had experienced, and we pushed forward. In terms of people coming inside, it's not like their idea. Whatever gender they identify with, that's what determines their gender. But yeah, we are able to specifically only open up the site for transgender women or gender nonconforming, people that are gender nonconforming.
All right, I have a closing question for everybody. Let me just tell everybody in the audience that we've recorded this. So if there's others you would like to see this, please feel free to, we'll send the link and you can post it. And again, encourage your friends and colleagues to make comments, because this is very important. My first closing question, brief question, is for Anne. Anne, you've worked at HUD. Does submitting comments matter? Do people pay attention? Will they be heard?
So I can only speak for the administrations that I worked for. I don't know how it works inside of the Trump administration, but the answer is yes. I mean, there are requirements. Staff have to look at them. They have to consider them as they're going to a final rule. And I know that we did. We changed policies because of comments that we got. So please, everybody, submit your comments.
Okay. And my final question for everybody to weigh in on, we'll go around, is beyond submitting comments before September 22nd, what else could we be doing as advocates, providers, friends, people with lived experience, to not only preserve the equal access rule, but actually to preserve and further the intent of the equal access rule, to make homeless service programs, you know, to make it better than harm reduction, to make it actually affirming, welcoming, safe and supportive environments. I'll go in the order people spoke. And do you want to add anything to your last comment? Jackie?
So I come from the data world. So my first thought is analyze your data. If you have, if you're doing VI SPDATs or some other type of assessment, look at the data. And if you have transgender people, do some analysis on what's happening. If you're having, you know, a rate of unsheltered homelessness that's much higher than cisgender people in your community, you need to take a look at that. You need to take a look at what the challenges are that transgender people face based on what their assessments are telling you, and then make data-driven decisions from there about how to, you know, adjust your program and provide the services that people need based on what the data is telling you.
Yeah, okay. If you have high rates of unsheltered transgender people, despite all your programs saying they're in no compliance, something's not working. So that
Exactly.
looking at it, that makes sense. Veronica, any last thoughts about what we can be doing to further?
Yeah, in particular to providers and system leaders, listen to the people in your community who are having a hard time accessing your services simply because they're a part of the LGBTQ community, and use those experiences to reshape how you do business within your respective agency, or again, if you're a part of system leadership, create policies that require folks to be served well, and then submit your comments. But God forbid if the equal access rule is overturned, I will still encourage you to make sure that the principles of it are applied in your respective organizations or in your systems, because it's important.
Jeree?
I accept both those challenges from Jackie and Veronica, because I think that's precisely what sometimes is hard for us as frontline responders in lots of ways. We don't always make the necessary time to look at the data and look at the data often. And then also, especially now, since here in Southern Nevada, we've been hit economically so hard by the pandemic, we haven't been having the conversations with our clients, particularly the transgender community, like we should be having, because we've been kind of distracted with pandemic response. And so those two things, as you were saying them, ladies, I thought to myself, those are exactly the things that I myself need to put on the front of, you know, put on the front end of what I'm doing, because the last, 6 months in, I think, to a lot of changes, especially here in Southern Nevada, we're facing unprecedented unemployment. And now, you know, we have an eviction moratorium that's going to be up, not just for us, but lots of states very soon, and what that's going to mean. And so before that even starts happening and we get further distracted, even though we don't mean to, those are two things that I need to put on the front burner, so that I am, me and my staff, that we're not even further behind. And I feel right now some of these crucial things can easily fall behind because we're in kind of crisis and emergency disaster mode in a way, many of us. So that's my challenge, exactly what you two ladies said. So hopefully we can, you know, stay true to that.
Debbie?
Yeah, I mean, I think Jeree and Veronica give really great programmatic examples of what needs to happen in terms of building out programs for transgender survivors and being inclusive. I think that there is a time, because we are in a disaster response time of now more than ever, people, especially survivors who are in danger and in danger for their lives because they're isolated with abusers, do need to know. And I know it's hard to do outreach during these times, but still doing outreach to the transgender and LGBTQI communities to know that we are there and here for them. And despite what messaging they're seeing, you know, on social media around the equal access rule, that in your communities, we're still going to serve you. And that's the messaging we're giving to our DV programs. We're still, whatever happens, we're still going to be serving transgender survivors. And with many marginalized communities and transgender communities, like if word gets out or if there's a program that isn't doing a great job, like there, you know, it spreads really quickly in a community, or if there has been prior harm done to the transgender community, I think work on rebuilding and repairing that harm so you can effectively serve those transgender individuals. And then I always just want to plug too, if someone's fleeing domestic violence, a transgender survivor, just believing them and, you know, having those safety planning and questions so that they can come into housing and homelessness programs and using the fleeing definition so they can be housed in programs. But yeah, thank you all for your time. I'm so glad to have been here with everybody. So thank you.
All right, well, thanks for everybody who listened in. I think what we heard clearly from all of the wonderful presenters, so thank you. I wish you guys could hear all the applause. But is preserving equal access rule is step one. It's a priority one. It's an immediate action that we need everybody to take and to do quickly. And so again, housingsaves.lives.org. But it's only a step, and there's a whole lot of extra work. We can't go backwards. We need to go forward. There's a far distance for us to go forward on, given everything that Jackie has recounted, and the fact that people are going to Veronica and Jeree's program and saying, I don't want to be in the regular programs because they don't feel safe in the regular programs. That's cold water that we're not doing everything we could do. So step one, let's preserve equal access, and let's talk about what else we need to do. Thank you everybody for your time, but most of all, thank you for your wonderful presenters. See you next time.
Thank you, everybody.
Thank you.